Hi, welcome to the Clear Living Well webinar. This webinar is designed to give you some more information about the Clear Living Well programme, which is designed to support PCNs to develop new care pathways for people at risk of CVD. This work is sponsored by NHS England. For context, around 15 million people in England are living with long-term conditions already, and the treatment and care of these patients absorbs around 70% of acute and primary care budgets. This is likely to increase as multimorbidity becomes a norm. We've got an ageing population, obesity rates are increasing, and this means that the number of people at risk of developing cardiovascular disease is growing. Preventative action is needed to deliver interventions to minimise this risk. Clear and NHS England are offering the opportunity to two PCNs to work with us to identify patients at risk of developing long-term conditions in your local population, and to develop proactive approaches to care across the system. This will help you as a PCN to address the requirements of the network DARES for cardiovascular disease and obesity, as well as meeting the goals of the NHS long-term plan. So what is CLEAR? CLEAR is an integrated learning and working programme developed by NHS clinicians for colleagues to develop new skills in data science, transformation and leadership, whilst also delivering live redesigned projects in the NHS. It's an apprenticeship, if you will, that runs over 26 weeks, where the CLEAR National Faculty take some of your staff and teach them the CLEAR methodology, whilst also delivering this live project. The CLEAR methodology has 4 stages. The first is clinical engagement. This is where we talk to clinicians to really understand the issues and analyse those qualitative data using a thematic analysis approach. We then go on to a data interrogation stage, where we extract clinical workforce and finance data and build it into data visualization dashboards. This enables us to look at the cohorts of patients that you have to try and identify those that may be suited to a new model of care. We bring those qualitative and quantitative data together and create a safe space for innovation, where we can design these new models of care and the associated workforce required to deliver them. The final stage of CLEAR is a recommendation stage, and this is where we do an impact assessment, an implementation plan, and present our recommendations to the board. The CLEAR programme has priority areas across the whole of England, working in 6 different priority fields. These include things like urgent and emergency care, and as well as anticipatory care, mental health, ophthalmology, operating theatres, and critical care, and has been running for around 5 years. So that's what CLEAR is, but let's give you an example of how it works in practice. This is an example from our urgent and emergency care project at Hampshire Hospitals Foundation Trust. From the engagement, colleagues noticed that there were a few challenges. There was duplication of front door streaming and triage, long waits for initial assessment, low staff morale, and high proportion of frail patients discharged within 24 hours of admission, which potentially could have been an avoided admission. After the CLEAR programme had been completed, we came up with a number of recommendations that included improvements to the streaming and triage processes, upskilling the existing emergency nurse practitioner workforce to see and treat minor illnesses, and the creation of a dedicated frailty zone to address the needs of these complex frail patients and avoid admission. The outcome of this was a change in the skill mix, with an increased utilisation of ACPs and EMPs, freeing up consultant time to work on other complex patients. The impact of this would be the prevention of around 6,900 admissions, as well as the upskilling and retention of staff by the development of these advanced roles. So how do we do the project? Who does the project? Well, we have a CLEAR team. That CLEAR team needs to be made up of CLEAR associates, and they're 2 to 3 frontline clinicians with experience of working in the system, released for 2.5 days per week. I want to make it clear at this point that the associates do not have to come from one PCN or one GP practice within that PCN. They can come from anywhere across the system, relieving the burden of the release of time, or spreading the burden of the release of time. We also need a CLEAR clinical sponsor who's a senior member of the team who understands the department and organisational goals, who can work with us for up to a day a week for 6 months. The National CLEAR faculty will also provide a CLEAR site team leader who's one of our national team to provide support or mentoring throughout the project. So what will you get? The output of the CLEAR programme, education and training for the clinicians that deliver the project. This will increase capability for data-driven redesign beyond the CLEAR project itself. You'll get detailed findings in a report and recommendations with this new model of care and workforce for preventative CVD action, which will help you to address the DES. You'll get a presentation of key findings to board and key stakeholders. You'll get senior clinical innovators and data engineers to work with your organisation, bespoke data analytics and modelling tools and visualisations for your PCN to use for the duration of the project. And this is all nationally approved with standards of project assurance and information governance. This also creates a nationwide community of practice as part of the National CLEAR project, with sharing of learning across different PCNs involved in this work. How much does it cost? Well, NHS England is supporting the delivery of the education, analytics, supervision, quality assurance, and the independent evaluation of the outputs. But you are required to release the associates, so there will be some backfill required. Again, I want to make it clear that these associates can come from anywhere across the integrated care system. We can also help you work with the ICS to see if there's any funding to support the backfill of these staff. These are our timelines. We have a webinar that will run on the 13th and the 21st of July, and our EOI closes on the 29th of July. This is a very short Word document to be submitted via email. Interviews will be in the 9th of August, and the project will go live in January 2023. Key to a successful application is evidence of an executive sponsor who's willing to support the project, a clinical lead for the project, and network team leads for information governance and data extraction. More information can be found on our website that you can see on the screen, and we welcome you to join us in our live webinar. Feel free to drop us an email if you have any questions, and we look forward to the opportunity to working with you on the CLEAR Living Well programme.